The purpose of the antibody testing is to help decide if you've had COVID-19 infection in the past. It really represents older infection, not something that is currently active. It would be helpful to try to explain possibly previous symptoms that you may have had, maybe help to understand an unusual type of presentation. But it's really to try to establish if you've had a recent infection with COVID-19.
People that are eligible for an antibody test are people who don't have symptoms or signs of the disease at the moment they go in to get tested. They should be people that have been exposed to somebody with COVID-19, either someone that they know for sure had it, or in a household where someone had COVID-19, or they should be people who are first responders, medical people, people working in nursing homes, or people who have exposure to a lot of people in the public. This would be grocery store workers, meat packing people, people working in institutions.
So testing positive does indicate that you've had the infection. This is something that I would discuss with your healthcare provider because they can help you understand perhaps when the infection occurred by talking to you about your symptoms. If you've not had any symptoms at all, then they probably won't be able to help you time that. But it's really a better discussion to have with your healthcare provider so you can understand exactly when that infection occurred and what the implications are going forward. So a negative antibody test also indicates that you are definitely still at risk for the infection, unless you're actively infected at the moment. But assuming you don't have active symptoms, it means that you are still able to become infected, and you need to follow all the social distancing, masking, hand washing, sanitizing, etc. recommendations that you've heard about on the news.
Well, the way to get an antibody test at Howard Brown is fairly simple. You have to call and make an appointment because you need to be assessed as to whether you're appropriate to get the test and that you don't have active signs or symptoms of the disease. Once that appointment happens, which can be face-to-face or can be done through telemedicine, then the provider will put in an order and then you can go to one of the laboratories that are in Howard Brown Health facilities and get your blood drawn. Insurance companies have said that they'll cover the test for patients who are coming to Howard Brown, who are Howard Brown patients. They will have the test performed on the sliding scale system, so there should not be associated costs.